resin materials, filler particles, coupling agents, coloring agents. All these four are separately present in the materials. Once we apply the light, all these come together and make their reactions. What is the name of that reactions? Anybody in the class? The name of the reaction is polymerizing reactions. So polymerizing reaction means the materials is become soft to hard stage. Once it's become hard stage, then we have to check the patient's bite and shape it down by the help of various dental bars. And finally, we get a complete rinse and dismissal the patients from the operatory. So this is the entire steps of the composite filling materials, and everybody should know because it will be asked in the practical competency test for the upcoming modules. So now we're gonna talk about glass ionomer, our next materials. So please study. If you do not study, if you do not look at the slides, it will not come to you. It will be looks like it will be hard, but if you go through the slides, definitely it will come to you, and you have to read many times. Now I'm going to the next material, that is glass ionomer. So in case of the next materials, the glass ionomer, I think we stopped here yesterday. So you're going to continue from here. So now the glass ionomer.
Hi everyone. This video will show you how to mix, load, and place alginate. My demonstration will use a mannequin, but in
Okay. Well, you can do it later, not now. Okay. So now we're going to talk about the glass ionomer. The glass ionomer, how they attached on the tooth surface. Anybody in the class? How glass ionomer attached on the tooth surface? Glass ionomer, it is the example of chemical bonding. I just mentioned just few minutes before. Okay, please follow the instructions. Okay, make the notes. So glass ionomer is one of the most versatile dental materials. It is a very common materials. If anybody's clinic has the glass ionomer, they don't need to take any other materials because they come with the 6 varieties. It is one of the most versatile dental materials which is available in dentistry. They adherent, that means they attached on the tooth surface by the help of chemical. So they adherent chemically to the teeth. So it means that they are the examples of chemical bonding. So they will attach on the tooth surface the chemical bonding. Very important to memorize for your multiple choice questions and final exams. Tooth preparation is less extensive than of an amalgam or composite resin restorations, as it is attached on the tooth surface by the chemical reactions. So the preparations of the cavity, preparations of the tooth is very simple and very easy going process and less extensive. You know that when we are preparing the tooth, we cut the healthy tooth. When the healthy tooth is cut, that means it is not coming back again because we already cut the tooth. So in case of the composite, we cast let. In case of the amalgam, we cut more. In case of the glass ionomer, we cut less. So it means that very less extensive procedure or tooth preparation in case of glass ionomer because the materials will attach in the form of the what do you call like chemical reactions, and it also release fluoride. This is very important. It can become as MCQ questions. That is the only dental materials which release fluoride. And we know that the fluoride is play a very important role for prevention of the dental caries. That's why we are using the fluoridated toothpaste in our everyday day. When we go for our brush our teeth, we look for the fluoridated toothpaste. We drink water which contain the fluoride. That means the fluoride play a very important role for the carries preventions, and it is converting the hydroxyapatite into fluoroapatite. That's why it is very important to know. The one of the dental materials name is glass ionomer. In short, we call them the GI. They will release the fluoride after the final setting. That means when when the glass ionomer materials attached on the tooth surface, when they are completely the hard sets, then they will be release the fluoride, because fluoride inhibits decay. Because fluoride inhibits decay. Very important to memorize. Chemical bonding, fluoride release, inhibiting the decay. This is all about the characteristics for the glass ionomer materials. Because before starting this module, I told you guys that you have to memorize the name of the materials. Then you have to memorize the properties of the materials, then chemical makeup and how it is applied. So this is the way you will be able to learn about the materials. Now, what is the indications of the glass ionomer? Indication means where we can use it. Glass ionomer we can use for primary teeth. It can be used for non-stress bearing area of a class 5 restorations. What is class 5 means? What do you mean by class 5 restoration? Where is the location of caries in class 5?
Cervical.
Cervical area of the tooth. Very good. So when the tooth cavity is present on the cervical area of the tooth, it doesn't matter anteriority or posteriority, that is known as our class 5 cavity. And also you can see the picture is showing the cervical area of the tooth. So we can give the restorations for the class 5. It can be sealants. It can be used as a sealants. When we give the sealants, which tooth we are giving the sealants?
Posterior.
Posterior.
Sealants is applied on the posterior teeth, especially for the young permanent teeth. Young permanent teeth, we are giving the sealants, premolars and the molars, to prevent the dental decay. It can be used for the core buildup, like when there is substantial loss of the tooth structures. Say, as for example, a tooth has pretty much destroyed all the surfaces of the tooth. Then we need to build the crown. That is called the core material to build up. So build up the tooth structure, that can be possible by the help of the glass ionomer materials. Another one is provisional. Provisional restorations. That is a long-term temporary restorations. That is called the provisional. Provisional means just a temporary restoration, but it's for a longer period of time. So for that time, we can use the glass ionomer materials as a restorative materials. So these are the indications of the glass ionomer. There are different types of glass ionomer. They are resin modified. One is metal reinforcements. So it means that a resin modified glass ionomer will give the more and better strength or greater wear resistance and improve the aesthetic quality. That will be the reason we use the resin modified. Sometimes we call them the IGRM. IGRM means glass ionomer modified glass ionomer, resin modified glass ionomer. So RMGI is very commonly we use. In short, we call the RMGI, resin modified glass ionomer. Sometimes we also see that the glass ionomer, they will also contain some metal particles, silver and tin alloy. Silver and tin is the metal part. So they will blend it. So manufacturers, they add some metal to reinforce the strength of the materials. So that is the silver or tin alloy with the glass ionomer provides a strong abrasions and resistance properties of the materials. They are the less soluble materials. We want the materials to be less soluble. This is one of the property we discussed yesterday, the solubility of the materials. If the materials is soluble very fast, then it will not be good materials. We want the materials which is less soluble. That is the glass ionomer is one of the example. What is the fabrications and application of the glass ionomer? So this is all about the properties. Now we'll talk about the applications, fabrications and application of the glass ionomer. Fabrication means how we mix the materials, or you can say manipulations. So manipulations or fabrication, whatever you say, and the applications. When supplied as a powder or the liquid for a cement, manually mix them together and treat in a treated paper. So they can become in the varieties of form. They can become the powder and the liquid. That means the powder of the materials and the liquid they need to mix together in order to make the materials to apply in the patient's mouth. For restorative process, glass ionomers are supplied in either light protected tubes, cartridges tubes, or the pre-measured capsules. So these are the different form of variety they are available in the market. Depending on the dental practice, they will be use this one. Some dental clinic they use powder and a liquid. That is a glass ionomer powder and a specific liquid for the glass ionomer. Some dental clinic they use the pre-measured capsules because you know that nowadays due to the advancements of dentistry almost every single materials they are come up with the pre-measured capsules. So you don't need to measure anything. You just need to attach them on the different varieties of vehicles such as gun or any apparatus which is useful for dispensing the materials from the capsules. So that's why it is very useful in terms of prevention the the infection control as well. So that's why the restorative procedures, the glass ionomers are be supplied in that different way. It can be come up with a light protected tubes or the cartridges or the tubes and as well as the pre-measured capsules. The material can be either manipulated with a spatula and placed in the applicators or triturated and then be placed in the applicators and then applied to the light cure materials if they are in the light cure in nature. So when it comes to here, these are some examples of the glass ionomer materials, powder and the liquid form, powder and liquid form, and then the individual capsules. So these are the varieties of way glass ionomers are available. So bottle and powder mixture is very common, and in our college we also have this, and you will need to know about this procedure, how to mix them and how to apply them practically. So theoretically, we have to know right now. And when you go to the practical class, we will start to mix these materials. So one comes with powder and a liquid. There is a very common procedure in the dental clinic. And they are not so expensive, but when you go for these three processes, like the capsule form, they are pretty expensive. Now the next is our temporary restorative materials. So temporary restorative materials, by name you can understand that it is given for the patients for a very limited amount of time. So designed to maintain a restoration function and keep the patient comfortable for a limited time. That's why it is called the temporary restorations. This limited time may be 1 week, 2 week, or maximum 3 weeks. So what is the indications are the following. So what is the indications? Number one is sometimes the patients come in the clinic with the sensitivity and the discomfort of the tooth determines to a diagnosis. So we are not confirmed like whether we go for final restoration, that is a permanent restoration or not. Sometimes the patient is giving some sensitivity history. So in that case, it is better not to go for the permanent restorations. We go for a temporary restorations for the time being. And if we see the patient is improving, there is no sensitivity, no discomfort, then we go for the final restorations on the top of the temporary restorations. Is maintain the function and aesthetics of the tooth until a permanent restorations can be placed. That's the way we usually go for temporary restorative materials. It also helps us to protect the margins. At the later date, it will be receive the fixed restorations. Sometimes we use it as a temporary cement for attaching the temporary crown for the patients, those who are waiting for their final restorations. It also helps us for preventing shifting and as well as adjust the opposite and adjacent teeth because of the open spaces. So these are the all kind of indications is for the temporary restorative materials. What is the name of that materials? We call it the IRM. That is also another important materials which we will going to mix in our practical class. IRM means I for intermediate restorative materials. So these materials, chemically it contains the zinc oxide eugenol. So zinc oxide eugenol, zinc oxide eugenol. So zinc oxide is the name of the powder and eugenol is the name of the liquid. So combinedly we call them the zinc oxide eugenol. In short, we call them the ZOE or ZOE. It also known as ZOE. ZOE is the short form of IRM. So this is a very common use for IRM in the dentistry, such as restorations of primary teeth, restorations of primary teeth in case of the emergency, restorative emergencies. The emergencies in a sense like sometimes patients come up with severe pain. So it contains the eugenol. So eugenol, it is the its chemical ingredients is the clove oils. So clove oils is the one which will be very promptly, thus give a soothing effect of the pulpal tissue. It sedates the pulp so that the patient's pain can be dropped immediately. So that's why this type of materials can be used for the restorative emergencies. Caries management programs. When the patients come up with say 5 or 6 caries at a time, it is not done. It is not possible for the dental surgeons to do all the filling at a time. So they will do it part by part or quadrant by quadrant. But to prevent the extensions of the cavity, immediately they will apply the IRM for the caries management programs. And it also considered as a base materials. Base materials means sometimes we need to put some extra materials before we go for the final restorations. And those extra materials is considered as a base because we put it on the bottom part of the restorations. That's why it's called the base of the materials or base of the restorations. So these are the indications or common use for the IRM. Then there is another materials that is called the provisional restorative materials. As I mentioned, that provisional means long-term temporary. So it is not the permanent, it is the provisional that was given for the for a time being, like maybe 1 week or maybe 2 weeks, while the patients are waiting for their final restorations. So it is designed to cover the major portion of the tooth or several teeth for a longer period of time. That's what is called the provisional restorative materials. And even though it's temporary, but it should be enough strong and withstand the biting force and the daily wearing. Because if it is temporary, it doesn't mean that it will not capable for withstand the biting forces. Because during waiting for a permanent restorations, patients need to eat. Patients need to protect their teeth for the daily wearing. So that's why the to protect provisional restorative materials is the one which is made by a different type of material. It can be composite materials. It can be the methyl meth acrylate materials, or it can become in the form of tube, the paste form. So whatever the powder, liquid, paste, or gun form, they need to be used for a protections of the permanent teeth when is waiting for its final restorations. Next materials is tooth whitening materials. Tooth whitening materials, we are using the peroxide materials. That is one of the most popular and cost effective way to restoring an aesthetic appearance of the teeth. For appearance of the teeth, we are using the improving the appearance of the teeth. We are using the peroxide materials. There are many other ways. We can do the coronal polishing. We can apply the new restorations, but this is cost effective. It is not so expensive. So even the Shoppers Drug Mart or even Walmart, you will see some over the counter whitening product. They also use use for improving the appearance of the tooth. But it is better to use any kind of whitening materials with the permission or with the discussions with the dental surgeons. Because if you do not properly handle the over-the-counter materials, that will create the sensitivity for your teeth. So there are many patients we saw every time they are coming up with the sensitivity because they use over-the-counter materials without following the proper instructions. So whitening products can be found in many everyday items such as toothpaste. You will see there are many toothpaste. They claim that whitening toothpaste. It is a toothpaste, but at the same time, it will increase the shininess of the teeth. Whitening toothpaste, fluoride containing toothpaste, mouth rinses, and as well as the chewing gums are also available nowadays to improve the color of the teeth. That is called the all whitening materials. So most of them are made from peroxide based materials because peroxide is the main component here. So hydrogen peroxide is the main component for the whitening procedures. So these peroxide materials, they will be come to improve the discoloration of the teeth. These are the some reasons behind it, why the tooth is discolored. Sometimes the aging is the one factor. Aging is one factor to discolor the teeth because they maybe take coffee, tobacco, or the consumption of the coffee, tea, colas, tobaccos. They will make the stain on the tooth surface. Trauma is the another factor, like the sports injury, especially for the kids patients. When they get the sports injury, the tooth become discolored because the rupture of the blood vessels inside the tooth. Use of tetracycline, which also mentioned before, that tetracycline is one kind of antibiotic. And this antibiotic, when the pregnant women use, they can easily cross the placental barrier and they can be discolor the tooth, and it is yellow, bright yellow color of the teeth we can see. That is called the tetracycline disorders. Or even we are not giving the antibiotic for the growing age of the patients because that also create the discolorations of the teeth. Excessive fluoride. We know that the fluoride is important for us, like 1 ppm. 1 ppm means 1 part per million fluoride in the drinking water. That is the optimum level. That is the correct level of the fluoride. Country like Canada, US, United Kingdom, they maintain the fluoride in the drinking water. But if it is excess more than 3 ppm, then it will create the discolorations of the teeth. So that's why excess fluoride also cause the discolorations of the teeth. Then the nerve degenerations, because every tooth we know they have the pulpal tissue come up with the nervous tissues. So if the nerve tissue is degenerated, tooth become discolored. And the aging of the restoration. Sometimes the restorations are pretty old. They will leaching out the materials. When the leaching out the materials is coming, leaching out means the materials is gradually dissolved on the tooth surfaces and they will make the discolorations, or you can say they will be integrated inside the tooth because of their stay for a longer period of time. So that is called the leach out the materials. So that is the aging of the restoration. So these are the cause. These are the cause for a discoloration of the tooth. And also there are some people, those who are a news reader or those who are the film actors, they also want their tooth to be white. So they need to go, they are using the peroxide materials, or they went to the dentist and they will do the bleaching. So bleaching is not good for the teeth. It will produce the temporary sensitivity for the patient because it will remove the some tiny layer of the enamel. And we know that the once the enamel is lost, we are not able to get the enamel in our life anymore. As you can see at the improvement. So this is about the before and after the procedures. So tooth whitening procedures can be done in 3 ways. One is in office procedures. The in office means in the dental clinic. One is the take home whitening. That is, we can use it in the home under the supervisions of the dental surgeons. Another one is the OTC, over the counter whitening procedures. So these are the 3 ways we can go for whitening our teeth or improve the appearance of the teeth. This is not the restorations. This is aesthetics. This is, we just try to improve the color because everybody want the white teeth, but due to some disease, the teeth are not white. Due to some genetic influence, the teeth are not white. They may be yellowish brown, or they may be deep brown. So these are the conditions we can see from the patient to patient mouth. What is the method of whitening? When it comes to the in office, it is very effective. Within like 6 to 15 minutes, it will be improved. The reason is here here the dental clinic, they are using the laser bleaching procedures. That means they apply the peroxide materials on the tooth surface, and at the same time they apply the in the light. So this light will breaking down the hydrogen peroxide materials. And these peroxide materials, when they're breaking down, they will produce the latent oxygens. So these oxygens or free radical of oxygen, they will reacting with the stain which is present on the tooth surface. So this is the way within like 6 to 15 minutes it get improvements because they are using the high concentrations of the peroxide materials, which is about 30%. But over the counter, those are less than 30%, maybe 10 to 15% is the maximum we can see in the over the counter. As you can see here, these are the at-home process. So we make some tray for the patients. That is called the custom tray. Custom tray means it is only fit for the patient, a individual person. So we'll make a custom tray for the patients, and the patient will load the materials here, and they will apply these onto the patient's mouth. And mainly the oxidizing agents, they will be change the color because peroxide come up with H2O2, that is the hydrogen peroxide. Usually they will be reacted like, as for example, we call them the H2O2, that is called the hydrogen peroxide. Hydrogen peroxide, chemically we call them H2O2. H means hydrogen, O means oxygen. So hydrogen and oxygen, two molecules of each. Now when we apply these materials, when we load these materials in the patient's the mouth, then we will make a light. When we apply the heat, it will be divided into like this, H2O plus O, that is the reactions. So when the O, this O is the free oxygen, and this oxygen will react because this is water, it dissolves in the oral cavity. But this oxygen, they will react with the stain. They will react with the stain what is present on the tooth surface, and the tooth become white. Okay, tooth become white. This is called the whitening process. Tooth whitening reactions by using the peroxide materials. This is the whole mechanism. And the reason we apply the heat, because if we give it the heat, then that will be reacted fast. That's why within 5 to 15 minutes, we can improve the patient's teeth from stain removal or from, the yellowish white to more white. So that's why it is called the less time and the cost effective process for whitening procedures. And these materials concentrations will variable. It can be 30%, okay, it can be 10%. So definitely the one which is 30%, which is professional use, dentists can be used only this percentage. In the outside, they will be used 10% because it is not a good material. It can be caustic for the gum tissues. So that's why professionally when we use, we are using 30%. And that's the reason the time is less because it is high concentrations. So this is the way usually the whitening is taking place. Now the next is indirect restorative materials. So up to this point, every materials are direct. What is the meaning of direct materials? Direct restorative material. That means we directly put in the patient's teeth. That's why it's called the direct materials. But here we call the indirect. Indirect restoration means the entire restorations will be fabricated outside the mouth and then we put it in the patient's mouth. Okay, that's why it is called the indirect restorative materials or indirect restorations. As you can see here, the indirect restorations are fabricated outside the mouth by a dental laboratory technicians. Dental clinic and dental laboratory, these are not the same place. Some dental clinic, they have a lab and the clinic together. But some dental clinic, they don't have the lab together. So sometimes we need to depend on the dental laboratory to perform the indirect restorations. So indirect restorations will be made from the indirect restorative materials, such as the porcelain crown, zirconia crown, metal crown, or the sometimes we call the cap, tooth capping. They are all coming, or veneer cap, breeze, inlay, onlay. They are all known as indirect restorations. They should be made into the laboratory. So there are some chains of procedures. So these chains of procedures we have to memorize because this is the steps we have to follow, and that will help us to understand about the how the indirect restoration is made outside the patient's mouth. So indirect restorations, in order to make inlay, onlay, crown, breeze, these are the examples of indirect restorations. So first of all, we have to prepare the tooth. Preparation of the tooth means we have to cut the tooth structures. Then after preparation of the tooth, we have to take the final impressions. So impression means it is the measurement of the tooth and its supporting structures, and which is known as negative reproductions of the tooth and its supporting structures. So after taking the final impressions, we will send it to the laboratory. In the laboratory, they will make the model. On the top of the model, they will make the waxing pattern. That means they will make the restorations in the form of wax. Then they will invest them into the investment materials, and then they go for the casting. That means they will remove the wax by the de-waxing process and the casting process, and then finally they will apply the materials. It can be ceramic, it can be the what do you call, like metal. So then they will apply this one, and after that they will go for the finishing, polishing, and of the casting procedures. And finally, the materials or restorations is ready for the patient's mouth. When it comes from the laboratory, our job is just to cementing it onto the patient's mouth. That means cementing the restoration in place. So that means entire restorations is made outside the mouth. Outside the mouth, that means in the laboratory, we make it. Once the restoration is made, then we will get it from the laboratory and we just do some minor adjustments if required. Sometimes without any adjustments, we apply it into the patient's mouth. Now, what are those indirect restorative materials? The gold is one of the very common materials we use. We call them the gold noble metal alloy. So these alloys, when they are mixed up, we call them the alloy. You remember we talk about the mixing of the metals. When the metal are mixed together, they call them the alloy. Gold is its purest form is much